Hello there, my name is Mark Woodfield. I'm a senior lecturer in medical imaging at Teesside University, and what I'm going to be doing for you guys in SIRNR today is essentially a kind of very basic kind of vascular anatomy primer, if you like, and this is to go with the up and coming cross-sectional anatomy, where again we'll be concentrating on vascular anatomy. So what we're attempting to do today is essentially just to make sure, just a basic recap really for you guys, is just to go through sort of clinically relevant venous and arterial anatomy, and we'll also as well, before we do that, just have a very quick overview of the cellular vascular anatomy as well, kind of the tissues that they're made up of. Just because obviously as we come to talk about pathologies and those sorts of things, that's when these sorts of things become quite relevant really. Okay, so we're going to move on to, as I said, first of all, this is going to be cellular vascular anatomy, and what the two diagrams here represent are the different structures of arteries and veins. In general, the structures are fairly similar. Obviously they've all got a lumen, which is the hole of which the blood travels through. They have a tunica intima, which is the inner layer of the lumen, and they have a media, which is the smooth muscle filled middle layer, and then an externa or adventitia, which is a layer of loose fibrous connective tissue. So in general, arteries need to maintain a higher pressure than veins, and therefore they've got a larger media, so more smooth muscle within the arterial wall, and that's there to kind of maintain the pressure and to push blood along. Knowledge of anatomy is quite useful when we discuss pathologies, things like aortic dissection or alternative treatments, such as things like subintimal angioplasties. Obviously those terms, you'll need to know the vascular anatomy and how that applies to those terms as well. So where are we starting from? Well, we're beginning with the great vessels in the aortic arch. I'm not going to do the neck and those sorts of things, they'd probably be covered in another instalment, if you like. So the first thing that we can see here is especially with regards to kind of arterial anatomy, is the brachiocephalic trunk, which is this piece of anatomy here. Moving kind of posteriorly to that, we've got the common carotid, left common carotid, and the left subclavian artery there as well. Now the brachiocephalic, or sometimes called the innominate artery, that bifurcates a little bit more distal to the aortic arch into the right carotid and the right subclavian arteries. There can be some differences in the orientation of these vessels. Occasionally the left vertebral artery may arise from the aortic arch kind of posterior to the left subclavian rather than from it. So in general they don't really cause any particular problems, but if we were going to do some type of treatment within this area, so a TEVA or something like that, then obviously you'll need to know if you're going to be covering the left vertebral artery, so you might need to make a fenestration for that, or land kind of posterior to that if there is one. Okay, so moving inferiorly from the left subclavian, there are some smaller vertebral arteries that arise from the aorta. But the next major vessel of importance is the celiac trunk, or the celiac axis, which is this piece of anatomy kind of coming off anteriorly here. So the celiac trunk, celiac axis, provides arterial blood supply to the foregut, the stomach, the spleen, the liver, etc. There's usually quite a small artery kind of arises immediately from it, and that's usually the left gastric. And then you've got two main arteries, common hepatic and the splenic artery, kind of bifurcating outwards from that. So immediately inferior to the celiac trunk, we've got the SMA, or the superior mesenteric artery. Now, excuse me, The SMA supplies the midgut, so essentially things like the pancreas, ileum, cecum, appendix, colon, and other associated mesenteric structures. So we now turn our attention to the vena cava. Now, the superior vena cava, which lies above the right atrium, if I can just come into here and here to show you, this is the superior vena cava. Now, the veins that join together to make up the vena cava are the right brachiocephalic vein, the subclavian vein, and then the internal jugular vein. No, that's wrong. The long vein that you see here is the azygos vein. The azygos vein receives its blood from the segmental veins of the abdomen and the lower thorax, and then brings these up here and then empties them into the SVC, which will obviously then take them into the right atrium. Now, the inferior vena cava, which is our large vessel immediately sort of posterior to the right atrium here. Now, this receives its blood from the common iliac veins, which obviously brings all of the blood back from the lower limbs. The renal veins, which you can see just about here and here, and of course the hepatic veins, which drain into the IVC, sorry, as well. This image is actually quite nice because it shows the IVC and abdominal aorta kind of next to each other. Now all of the different sort of veins and things interconnect. Also, what it shows quite nicely is the kind of the tortuosity of the splenic artery there, shown quite nicely. And then, of course, we've got our common hepatic artery coming off there, with our superior mesenteric artery coming away as well, the azygos vein, and the IVC. Also, what you can see coming here are the renal arteries, just kind of superior to the renal veins. Now, as you come sort of down the abdominal aorta, what we can also see here is the inferior mesenteric artery. So if we just sort of zoom up a little bit there, this is the bit that we're going to be concentrating on here. Also, what we've got is, once the abdominal aorta bifurcates, I'm sure you're all well aware, we've got the common iliac arteries, and then these bifurcate again to the external iliac artery and the internal iliac arteries. Now, the internal iliac arteries, they obviously supply the pelvis and the perineum, and also a little bit of the kind of posterior thigh. Now, the veins do tend to mirror the arteries in these segments, so you've got the external iliac artery, external iliac vein, internal iliac vein, etc., etc., before it gets into the inferior vena cava. Now, as we move into the lower limb, and I'm sure you're all aware of this particular point, is that once the external iliac artery passes underneath the inguinal ligament, then it will become the femoral artery. Now, the inguinal ligament lies kind of roughly along that sort of area, there. Okay, so once it passes underneath that, then we've got our common femoral artery arising there. Now, along the length of the femoral artery, many different branches do come off. We'll concentrate on the right side here. Do come off, but kind of the main ones that we tend to see within our angiograms is the profunda femoris, which comes off here, which supplies all of the thigh muscles. Now, the femoral artery will continue until it reaches the popliteal fossa, where it will become the popliteal artery. Now, here we can see the femoral vein, okay, which is a deep vein. And we've also got one of the more kind of superficial veins here. So this is the great saphenous vein, joining on to the femoral vein there as well. So what we've got here, and I've split these into two different bits, is we've got sort of two different views of the arteries in and around the knee. So this is the anterior view, and then what we're going to do in a moment, we'll flip that around and we'll have a look at the posterior view. So the blood supply in and around the knee, particularly the anterior part of the knee, these are known as the anterior recurrent arteries, form almost like a sort of circle of Willisy structure, if you like, which obviously can make, if those arteries are blocked, can make the body bypass it and those sorts of things. What we can see here is just before it becomes the popliteal, we've got an artery coming off here, which is the descending genicular artery. The other genicular artery is probably best seen on the posterior view. The popliteal artery can be said to begin after the bifurcation with this descending genicular, so this is where it becomes the popliteal artery here. So the only other artery that can be seen, kind of major artery that we would normally see when we're doing our angiograms, again if I can just move it and we can just zoom up a little bit here, is this artery here, which is our anterior tibial there. Okay, so what we're going to do now is we're going to have a look at the posterior views. So here again we can see popliteal artery with the popliteal vein there as well. Now what we've got here are the superior lateral and superior medial genicular arteries with the inferior lateral and inferior medial genicular arteries there as well. The great saphenous vein can also be seen here, sort of medial to the knee joint on both sides there. So again, if we can just move this a little bit over towards the right and focus down, let's have a look what we can see here. Okay, again what I'm going to do is I'm just going to bring it right up here around the sort of tibial-perineal trunk. So the first artery that you can see bifurcating again here is the anterior tibial, which will be coming kind of anteriorly, obviously, and then going down the front of the lower limb. Then we've got the kind of tibial-perineal trunk here. What you can just make out here is the perineal, or the fibular artery. Then we've got the posterior tibial coming away here as well. And again, the veins will make up exactly the same sort of thing. So we've got the anterior tibial vein, perineal vein, and the posterior tibial vein there as well. And just so that we've got a complete picture, this is the lesser saphenous vein, and of course the greater saphenous vein there as well. Okay, so on this view we can see our anterior tibial vein coming along nicely there, with the saphenous vein, greater saphenous vein, sorry, here, and then also if we can just move up a little bit, we can see the dorsal venous arch, which are all of these vessels here. Now, the anterior tibial comes down, then bifurcates into the dorsalis pedis, which is this artery here, and the lateral tarsal artery, which is that artery there as well. So those are the sorts of arteries we might be looking for if we were doing kind of a lateral foot in our angiogram series. So we're going to turn our attention now lastly to the posterior view. Sorry, but just before we do that, just again a couple of quick notes on the venous drainage here. So I've obviously mentioned the dorsal and then the great saphenous vein. And again, following our arteries, we know that this here is our anterior tibial, which would make this vein here the anterior tibial vein. And you can just about make out the perineal artery here, and then the perineal vein and the small saphenous vein just lateral to that there as well. So on the posterior view we can see a couple of arteries really nicely here. So here is our posterior tibial here, and our perineal artery here, and obviously, as with all of these things I've been going through, they're obviously mirrored on the opposite sides there. Now if we move on from there, if we just have a look at the kind of ankle joint area, what you can see is that the posterior tibial artery comes down kind of, if I just bring this up and zoom a little bit, the posterior tibial comes down and it passes past the ankle joint, and it also passes just medial to the calcaneum. Now we can just, I think, just about make this out on the opposite side here, on the right side, and just about make out is that this is the posterior tibial coming down, and then this is the point at which it bifurcates, and it bifurcates into the lateral and medial plantar arteries. So this will be the medial plantar artery here and the lateral plantar artery there as well. Now if we move over onto the other side, just because I think it's a little bit easier here. So going from laterally to medially, looking at our venous supply, what you can see here is moving from, like I said, laterally, lateral side to medial side. What we can see here is the small saphenous vein. Now we know that this is our perineal artery, so this must be our perineal vein. We know that this is our posterior tibial artery, so this must be our posterior tibial vein. So I hope that you've all found that useful. As I say, if you're kind of working in the angio suite day in, day out, and this is probably a little bit like teaching your granny to suck eggs, but it is meant for kind of people who've perhaps just gone into the angio suite, want to bone up a little bit on their anatomy, and also just a little refresher for the cross-sectional anatomy that I'll be undertaking via Mazaru in late January, and you should all sort of receive an email about that from my colleague John Pierce, or from anybody within SIRNR. So thanks a lot for listening, guys. If you do want to leave a comment on YouTube, please feel free to do so. Please also suggest anything else that you might want a little one of these videos about, and then obviously myself and John can kind of have a look around and see who's sort of best placed and to do one for us on your particular topic. So thanks a lot, guys, and hopefully see you at the end of January. Thank you very much. Goodbye.